This is Dr. Dennis Locke, Sports and Regenerative Medicine. Today we're going to talk about hip pain, hip arthritis, particularly as it pertains to martial artists. I get a lot of martial artists and a lot of athletes in here. One of the things about martial artists that's different is that they often undergo repetitive kicking techniques over long periods of time. And I've had just about every type of martial artist in here. We've had Kung Fu, we've had mixed martial artists, we've had Taekwondo, Aikido, we've had all types of mixed martial artists in here. The problem is when your hip becomes arthritic, it makes it very difficult to do these maneuvers and also to maintain flexibility. This particular gentleman here was 80 and his hips were pretty good, but his knees were bad. And as you can see, right after we treated him, he still was able to do complete splits. So a lot of the martial artists can retain a lot of their flexibility and technique into later ages. However, when the hip goes, it makes it very difficult to do this. The hip is a ball and socket joint, and the femur articulates with the acetabulum. So you should have a nice round femoral head, and the acetabulum is a socket, and you should see a space between, and there should be a nice area between the femoral head and the acetabulum where the labrum attaches, so it can glide freely in this joint, acting as a ball and socket joint. What we see here is an abnormal hip. I like to call this more of an anvil shape, and as you see, instead of a ball, this has been flattened and deformed, and this is what we see unfortunately in some of these hips that have been really abused. Is the shape of this has just become more like an anvil, and this is not a very good functioning hip, and you can imagine that that's not going to take a very good impact, whether it's running or kicking maneuvers or even flexibility. Once you get to be an older age and you have a deformed hip like that, there's no making this new, even with regenerative therapy. Regenerative therapy in older patients with arthritis, you can hope to prevent progression, you can hope to prevent continued propagation of the inflammatory cascade, and also you want to give counseling to the athlete about what they're doing that's potentially wrong. And this is a classic example where somebody who doesn't know what their problem is, and if they keep abusing it, they're going to keep running into trouble. And that's one of the things we're going to talk further about in this blog. Thank you.